Hello, my name is Pam Fenner. My two children and I were diagnosed in 2009 with Ehlers-Danlos syndrome and related disorders. My daughter Eden and I have Chiari malformation, and my son Roman and I have intracranial hypertension. Eden has been affected since she was a toddler, possibly even as an infant. I don't think that she has ever known a life without pain. Roman became more affected as a teenager. My symptoms became severe after the birth of Eden. Not too long after, Eden developed symptoms of her own that became quite worrisome. We noticed that she gasped for air while sleeping. She talked about the sounds of bees buzzing in her ears and complained of daily pain, often saying that her bones hurt. She had episodes of unawareness and had great difficulty with walking and would fall over a lot. She crouched and dragged her feet. So Eden had a brain and full spine MRI when she was 2.5, and I will never forget that day. The day a radiologist handed me the MRI report to take to the neurosurgeon. On the way home, I read the word Chiari for the first time. I had no idea how to even pronounce it. I immediately Googled it and had to stop reading after a few sentences because I literally thought I was going to be sick. I was reading about brain that had herniated into the spinal canal, compressing the brainstem and obstructing the flow of cerebral spinal fluid. Although this was very hard to digest at the time, it was finally a huge answer to part of Eden was suffering with, and in an instant I knew this was actually what I had too. It was from that day on that life became a whirlwind. Even with the diagnosis of a Chiari malformation, several neurosurgeons who we saw believed it to be an incidental finding and not the cause of Eden's problems. Most of them shared that they had never seen a presentation like hers, and one told me that I needed to come to terms with the fact that her problem was not Chiari, but rather cerebral palsy, even though there was no MRI evidence of cerebral palsy. What made Eden's presentation of symptoms so confusing was that she also had Ehlers-Danlos syndrome. I was told that both of my kids were very hypermobile by their different doctors, but never knew why or what truly could happen as a result of that. This was all finally starting to make sense. And just when I thought that maybe Roman was not affected as Eden and I, he started to go downhill his sophomore year of high school with problems related to craniocervical instability and high cerebral spinal fluid pressure in his brain. His head felt like a bowling ball from poor ligaments in his neck not being able to hold it up. He was like a bobblehead. He was dizzy, had widespread nerve pain, neck pain, bad headaches, dementia-type symptoms, and an erratic heart. If you asked him what his worst symptom was, he would tell you it was the brain fog and not being able to think straight. His grades became affected. All three of us have had multiple surgeries, brain surgeries. Eden and I had brain decompression surgery for Chiari, and actually Eden had 3 of those. I had a stent placed in a vein in my brain to promote better blood flow, as the draining veins in my brain were almost completely closed, and Roman had surgery to have a shunt placed in his brain to lower cerebral spinal fluid pressure. And we all have had spine surgeries, such as fusing our skulls to our necks, fusing our other areas in our necks, and tethered spinal cord surgery. Of course, all of these surgeries come with a lot of risk. One of these surgeries would be awful enough. It's heartbreaking watching your child suffer and go through surgery after surgery. Each surgery has allowed my kids to return to school and to continue to have somewhat normal life. My surgeries have allowed me to continue to be a mom and caregiver to my children. Unfortunately, many people will never receive a proper diagnosis or even make it to the right doctor. Even worse, many will lose their lives. We try to live as normal as possible, believing that we are stronger than anything that we face. A typical day can consist of me spending hours on the phone with insurance, straightening out issues, scheduling doctor's appointments for all 3 of us, or taking the kids to their appointments or going to mine, making sure that medications are filled and picked up at the pharmacy, or one of us going to physical therapy. Daily life sometimes involves triaging who is worse off. One time I got called up to school because Roman was having a seizure, and another time I got called up because Eden was experiencing temporary paralysis of her entire body. Her top vertebra was almost completely dislocating off of her second, except we didn't know it at the time. Imagine looking at your daughter and her not being able to move anything but her head. We've been through the ringer. We simply have good days and bad days. On the good days, you try to do as much as possible, spend time with family and friends, knowing that you're going to pay the price for overdoing it. And on the bad days, you sometimes have to back out of things. Maybe the kids don't go to school, or you spend the day in bed. It's quite challenging to maintain a sense of normalcy when you are faced with these day-to-day challenges. I think one of the most frustrating things about living with EDS, Chiari, and related disorders is that you're fighting an invisible illness that people can't always see, and that includes doctors. It's also very frustrating that most doctors, emergency rooms, and insurance companies don't understand your diagnosis, therefore not knowing the necessary treatments, imaging to order, or even how to help you. Some doctors might think you're crazy simply because you look too good, and they have a hard time believing your symptoms. We can help to make this happen by sharing our medical records and information with scientists and researchers through the CSF International Registry. I'm thrilled about the chance to be able to make a difference. I'm very open to allowing scientists and researchers into both mine and my children's medical records. Allowing access to our private medical information will help provide a better understanding of our conditions. It will promote great collaboration. Most of all, it will hopefully one day lead to a cure. The CSF International Registry is unique because it has individual privacy settings. You are able to select the amount of private medical information that you feel comfortable sharing, and also have the ability to select the research studies that you want to be involved in. You can choose high privacy setting, where no one can see anything without your consent, medium privacy setting, where some of your medical information can be seen by all researchers, and low privacy setting, where everyone can see all of your medical information. I chose the low privacy setting because I would like the researchers and scientists to have complete access to all of mine and my children's information. I believe that through sharing this information in its entirety, that they will have a better understanding of the timeline of our symptoms, along with seeing the surgeries and treatments that have helped us. Whatever privacy setting you choose is okay. The important thing is to stick with the database and answer the survey questions that come to you. You are in control. Your participation will help researchers and scientists answer key questions that will unlock the answers we all seek. Patients should take the time to join the CSF Patient Registry, because while we can't change the fact that we have EDS, Chiari, and related disorders, we can perhaps change what the future will look like. Sharing information is critical for research to move forward. I am thankful for this huge opportunity to help give my family and other families just like mine the chance for a better tomorrow.